have stagnated at pandemic levels or continued declining. Low-income countries are struggling the most. This is because they are facing other challenges such as conflict and crisis, but also because over many years, they have not had the resources to build resilient health systems. The data indicates that countries with steady, sustained vaccination coverage in the years before the pandemic have been able to stabilize immunization services since. Regions that suffered long-standing declines, such as the Latin America and the Caribbean, have not been as resilient. This underscores how important it is for governments to make progress in immunization coverage, but also maintain adequate investment to sustain their achievement. What is at stake in this critical decision of either to make this investment or not is children's lives. Since coverage levels declined, we have witnessed outbreak of diseases such as measles, yellow fever, and diphtheria increasing, and our efforts to eradicate polio have been as well set back. 59 countries reported a total of 80 measles outbreaks in 2022. If we don't catch up vaccination of older children that were missed since 2019, quickly and urgently, we will inevitably witness more outbreaks and be responsible for more child deaths. In 2022, some countries demonstrated that this recovery is indeed possible. Let us receive the findings from WHO and UNICEF today as a powerful and urgent call to action and help countries everywhere follow this important call to action. Governments have an opportunity in this moment to primarily double down on their commitment to increase financing to immunization and also work with the stakeholders to unlock available resources to implement catch-up efforts. This includes COVID-19 resources. Secondly, enable immunizers reach children who were born just before or during the pandemic and who are now moving past the eligible age when they would have been vaccinated by routine immunization services. We also encourage governments to build and sustain vaccine confidence and the acceptance through engagement with communities and health providers. And most importantly, for countries with stagnant coverage, it is critical that they strengthen primary healthcare services and expand immunization, including through community health workers. In that way, we can reach the most marginalized and least served children. Thank you so much.
Thank you very much for both these briefings. I would encourage your colleagues, if possible, to send the journalists the notes of what you said as soon as possible. And I see already Lisa raising her hands. Maybe it's because of that, because especially from New York, the audio was not always perfect. So if you could just send out the notes that you've used, Dr. Lemango, that would be really useful. So I'll open the floor to questions first in the room, but I don't see hands up. So let's go to the platform. Lisa Schlein, Voice of America.
Yes, good morning to everybody. Thank you for this. I'd like to know, you say that measles vaccination has not recovered. I'm wondering why particularly this. Does it have to do with the connection with autism still? And in regard to autism, perhaps you could talk about the situation in developed countries as well, whether there's been increased hesitancy on vaccinations, child vaccinations in general. And if you could elaborate a bit about the situation in Africa, why it remains the continent which has the least vaccination, whether I know inequities has to do with it. Is it mainly a matter of finances? Is it conflict? Is it climate change? Is it all of the above? If you could deal with that. And if you could lastly speak about what the main elements of recovery in your regard, money, of course, but what else is needed in order to get more children vaccinated? Thank you.
Thank you, Lisa. I don't know if Dr. O'Brien, you want to start, and maybe then Dr. Levango on the children's side.
Yeah, I'll take the measles part of the question, and maybe I can turn over to Dr. Lemango to address the situation in Africa. I'll touch just a little bit on the main elements of recovery. So on measles, let me just make a couple of points for clarification. So first and foremost, there is no causal association between measles vaccine and autism. I just want to make that very clear to all. And I know, Lisa, that what your question wasn't intended to imply that. There has been past reports that have been proven incorrect, and there is no link between measles and autism. So that's the first thing. Nevertheless, that misinformation stays out there. And I want to also say that there has been globally some improvement in measles vaccine coverage. We're at 83% coverage now in 2022, which was up from the low of 81% during the pandemic. So globally, we have seen an improvement. It's on the road to a recovery, but it has not fully recovered. And when you look specifically at low-income countries, that's the strata where there has been no recovery at all. And the reason for that is, first of all, measles is given at 9 months of age. That's when the vaccine is given, or 12 months of age. So it's a different time point in a child's life than when the first dose of the other vaccines are given, which are given somewhere around 6 weeks of age or 2 months of age. And so there are challenges that families face to continuing to bring children for their vaccines. And we've always seen that measles vaccine is at a lower coverage than the vaccines that are given at 6, 10, and 14 weeks. As children get older, the sense of urgency on the part of families for coming back to return to get more vaccines tends to go down as the child ages and they're out of that biggest, highest risk period, at least perceived by parents. So it's not news that measles vaccine coverage is lower than DTP coverage, but it means that children who are in the program get lost out of the program, that when the programs are not adequately following up with children to make sure that they're coming back for that 9-month visit or the 12-month visit for measles vaccine. In particular, in low-income countries, these are countries that as a group tend to be countries where there is conflict, where there's fragility, where health systems are weakest. And so the ability to do those outreach activities and the things that are needed to get kids to return for their measles vaccine is weakest in those countries. So that's on the measles side of things. And it is this growing immunity gap. In other words, for every measles case that occurs, somewhere between 12 and about 20 other cases will occur infected by that individual among people who are not immune. And the way that children become immune is best done by vaccination, not by actually getting infected and risking severe disease, death, or consequences of measles. In terms of the main elements of recovery, there are several things that we're really emphasizing and that we have seen in countries that have recovered. First and foremost is political leadership and political commitment. And that means usually at the head of state level, at the Ministry of Health level, to be out there expressing not just verbally and from an advocacy perspective, but from a funding perspective, from a health workforce perspective, from a commitment to the immunization program to assure that vaccines are procured and there are no stockouts. Other elements include the number of health workers, the supply chain, the adequacy of supply coming in, the confidence of communities in vaccination. All of these elements are part of what has resulted in a strong recovery in programs. I'll move it over to Ephraim so he can talk about the situation in Africa. So over to you.
Thank you. Dr. Limango.
Thank you very much, Kate. And thank you for the question on the African continent. Generally, what we are seeing in the African continent is a stagnation of coverage as compared to what we had in 2021, whereby the coverage of the first dose of vaccine against diphtheria, tetanus, and pertussis at this very moment stays about 81%, which means 8 out of 10 children are reached, but 2 out of 10 children remain unreached. And the third dose of the same vaccine is about 74%. So 1 child out of 4 children remain unreached in the African continent. This varies from subcontinent to subcontinent within that region. But what is really important is that Africa faces the challenge of limited resources, Available health facilities in the continent, especially in the countries that have high unvaccinated number of children, access to health facilities, most importantly, those delivering immunization services, is very limited. Number of health workers, really, the proportion is quite lower in the African continent as compared to other regions. And of course, investments in immunization financing are also limited within the continent. But this is further exacerbated by increasing number of conflicts and associated fragility. And the impact of the pandemic had also caused economic fragility in many countries, affecting their ability to buy vaccines and avail it to their people. We have also seen a bit of spillover from COVID-19 vaccination-related vaccine confidence challenge, which currently is improving across countries, but a vaccine confidence issue could also be stated as one reason. But the most important setback in the African continent is the weakness of primary healthcare systems to continuously and sustainably deliver immunization services. And that is why we continuously call upon governments and global partners to be able to support countries to strengthen their community health systems, which is a means to reach the last mile, which is a means to reach children that are living far from urban areas. It's also critical to keep in mind, even conflict and fragility make the greatest contribution. We have also a significant number of children missed in urban poor areas where social exclusion or inability of these communities to be registered and recognized limit the access to vaccination, in addition to the limited reach to children who live in remote and rural areas. Over.
Thank you very much. Thank you very much, sir. Indeed, this is so important. So we have a question from John Zarocostas, France 24 English Channel and The Lancet.
Good morning, and thank you for the briefing. I was wondering if you could put some context in all these numbers. Firstly, if you could tell us, if I got it right, I didn't hear the HPV vaccination rates. How much are the low rate is linked to the high cost of the vaccine for many poor countries? And secondly, what is the overall vaccination rate in some big African countries like Nigeria, DR Congo, Ethiopia, where they've got many burdens, including the high debt burden? In some countries, I think the amount spent on health is 15 times less than what they pay for their debt servicing.
Thank you, John. Who would like to take this up? Maybe on the numbers, Dr. O'Brien?
Yeah, I'll start.
And then maybe on the specific situation of the countries.
Yeah, I'll start on the HPV side of things, and maybe Ephraim can go over to the specific country data. So on HPV, the global coverage, as I mentioned, for the first dose of HPV in girls, which is really our focus because it's a cancer prevention, cervical cancer prevention vaccine. So we're at 21% globally. And that doesn't sound very high, but I'll give some texture to that. There are 130 countries that are using HPV vaccine for girls in their routine immunization program. Among countries that are actually using the vaccine, the coverage, depending on region or depending on income strata, ranges from somewhere around 55% coverage up to about 67% coverage. So even in countries that are using the vaccine, the coverage in girls who should be getting the vaccine is still growing and is still not where it needs to be. So that's one issue. The second issue is that not every country has the vaccine in their program yet. And that's part of the reason why the global number is as low as it is, because there are over 60 countries where the coverage of HPV vaccine is zero. In other words, it's not in the program yet. What's really important is that some of those countries are very large countries. India, Bangladesh are two examples. And yet the good news is that between now, 2023 and 2025, there are 26 countries that have committed that they will introduce HPV vaccine, including those two countries. And those 26 countries make up a very substantial fraction of the remaining cervical cancer disease burden. And so we do expect that in the coming years, we will see very significant progress. But to give you a point of where we're trying to head, the goal for the cervical cancer elimination strategy is that 90% of all 15-year-old girls around the world should be vaccinated with HPV vaccine. And that goal is a 2030 goal. So presently we're at 21%, and we're trying to get to a 90% of all girls vaccinated by 2030. So that's quite a distance to go. That means that more countries need to introduce the vaccine, and those countries that are already using the vaccine need to improve their programs to get higher coverage in the girls in their country. And you asked specifically about the price of the vaccine. For low and low middle income countries, this is not a barrier. And the reason is that those countries are supported by Gavi, the Vaccine Alliance, the funding agency for low and low middle income countries. And so countries receive the vaccine with substantial support. They do have a copay for the vaccine, but cost of the vaccine for those countries is not the barrier. We have in the past faced supply shortages. Those supply shortages are largely been relieved with new manufacturers coming in, but we still have to carefully manage the supply that is available to assure that every country that wants to introduce in the time frame they want to introduce can do so. I'll go over to Dr. Lumango for the question on overall vaccination in Nigeria, DRC, and Nigeria.
Thank you very much. And if you could just give a little bit more concise answers, because we have got more questions still. So Dr. Lumango, on the individual countries, please.
Thank you very much. And as a starters, for the African continent, which is home to about 12% of the world population, but it's a home to 54% of the un- or under-vaccinated children. So there is a significant proportion of children who remain unreached in the African continent. And this overall increased number of unvaccinated children is driven by countries that have larger population. For instance, from the West and Central Africa region, it is Nigeria, and from Nigeria and Central Africa is the DRC, and the Eastern and Southern Africa region, large countries like Ethiopia, Tanzania, and Uganda contribute to the significant number of improvements or declines in immunization coverage. In 2022, if you take specific, for example, the number of zero-dose children in Democratic Republic of Congo, for instance, we see that there is an overall increase of about 160,000 zero-dose children from the 2019 levels we had in terms of zero-dose children. In Nigeria, about over 250,000 additional number of zero-dose children from what we had in 2019 levels. So this is a significant increment, but the overall coverage in the African continent is also, it has stagnated, which means this increases as a result of overall population increase. So the African continent has two challenges. One is to reach more number of children, but also to improve coverage against increasing number of population. If you want to look at the specific coverage rates in these countries, for example, antigens such as the third dose of vaccine against diphtheria, tetanus, and pertussis for some selected countries like DRC currently is about 65%, which is only 65% of eligible children reached with this important vaccine. And I'm trying to look at the list. Nigeria is currently around 62%, which shows that there is a long way to go to be able to reach these children in these countries. Over.
Thank you very much. I know James is listening to us. It would be really important to have these numbers in writing to the journalists as soon as possible. James or Carla, please. John, I see you have a follow-up, but I'll give the floor to Gorky, who has been patiently waiting, and then I'll come to you for a brief follow-up. And really, I'd like to ask everybody to be a little bit concise. Bonjour, Gorky. Gorky Ndoye is our correspondent of the Soleil de Dakar and Continent Premier.
Bonjour, merci beaucoup. J'ai deux questions très simples. La première, on a parlé du pourquoi du nombre très bas au niveau de l'accès aux vaccins qui a été lié par nos brillants conférenciers, par le manque d'argent. Le dernier a parlé aussi de la surpopulation africaine. Bon, je voudrais leur demander, est-ce que dans leurs analyses, ils ont intégré que le fait que beaucoup de pays africains, notamment le Nigeria, ont des doutes par rapport justement aux vaccins. Si nous prenons l'exemple précis du Niger sur la COVID, ils ont reçu assez de vaccins, mais on s'est rendu compte que les gens ne voulaient pas se faire vacciner. Je dis cela parce que c'est très important pour nous, journalistes, d'avoir des informations très, très précises quand on parle au briefing. Et deuxième question, si vous le permettez, ce serait à vous, Madame la directrice, c'est concernant le deal sur le blé. J'ai une question par rapport à ça. Je ne sais pas si je peux la poser maintenant ou après.
S'il vous plaît, Gorky, parlons de ça après, parce qu'on a encore beaucoup d'autres guests, d'invités qui vont parler. Donc, je vous inviterai à me reposer la question, je m'en souviendrai à la fin. Mais je vais traduire votre question en anglais pour nos briefers. Gorky is asking whether in you've spoken about the problem of access to vaccination, but have you factored in that in many countries there is also some kind of resistance to the vaccine? He brought the example of the vaccines against COVID that were received by some countries in Africa in a sufficient number of doses, but not used because people didn't want to be vaccinated. So he's asking whether this has been factored in the list of elements that block vaccination, access to vaccination or vaccination in some of these countries. I don't know if Dr. O'Brien or Dr. Lemango want to answer on this.
Yeah, thanks. Alors peut-être je peux répondre en anglais, mais j'ai compris la question. So your question, very briefly, the main reason, the very overarching and dominant reason why children don't get vaccinated is around access. The vast majority of families, of mothers, of fathers believe in vaccines. They understand the value of vaccines. They've seen the benefit of vaccines. And this is true around the world. This is not only true in the African continent. But the reason why vaccines are not administered are access reasons. It takes time. It's difficult to get there. When you go to a clinic, they may not have the vaccines. It's around quality of services. That is the overarching reason, no matter what country or community that we look at. However, it is true that we are very concerned about vaccine confidence and the awareness of families around the benefit of vaccine. And clearly, the information, misinformation, disinformation that is growing in size and growing in scope is having some impact in some communities at specific times on the confidence that people have in vaccines. And so this is not to diminish that. And certainly part of what we see may be related to that. But certainly for childhood vaccinations, this is not the same problem as was seen in COVID vaccine, which has many, many attributes to it that created a great complexity. But so I don't want to diminish your concern or your question, but I do want to emphasize that that is not the main reason why countries have low vaccination coverage. It's about a system perspective. It's about the systems, as Dr. Lemango has referenced previously.
Indeed. And I also see that Naor has put a link in the chat to the rates of coverage in every country. So please have a look at the chat. John, you had a quick follow-up, and then we go to WMO and IFRC. And then Gorky promised at the end, I'll give you the floor on the Black Sea Grain Initiative. John, your follow-up, please, quickly, because the other guests
Can you hear me there? Can you hear me?
Yes, we can. Go ahead.
Yes. Dr. O'Brien, even with the co-payment, what is the average paid by a poor country for HPV? Even with the assistance of Gavi and the co-payment, what is the average cost per vaccine for HPV?
I'll get you the specific number, but I'm going to give you the range that it is. For a Gavi country, the cost that they pay depends where they are in the graduation phase for Gavi. But those countries that are fully supported by Gavi pay less than 50 cents per dose for an HPV vaccine. And I have to look up what exactly the copay is. So we'll get back to you with that specific number, but it's cents, not even $1 a dose, but less than 50 cents. I think it's 25 cents, but I have to look it up again.
So thank you very much. Jan, is that for WHO or for our next speakers? Okay, let's go ahead.
Can you hear me?
Oh, now we can hear you. Yeah, go ahead.
Ah, yes. No, it's not for WHO. It's on the Black Sea Grain Initiative.
Okay, we'll speak about the BSGI at the end, please. We have got several people. I know that you have questions. I don't think I have the answers, but I'm happy to try. But in the meantime, please, let's finish with our different guests, and then I'll take all your questions about the Black Sea Grain Initiative. So let's go. First of all, thanks very much to Dr. Limango for having woken up so early to brief us on this important issue of immunization. Thanks to Dr. O'Brien here in Geneva from WHO. Again, any follow-up, we have James, we have Carla. We're happy to help the journalists here in Geneva. And I now turn to our colleagues of WMO and IFRC. I don't need to say again how hot is this room. We say it every time we meet. So I know some of the journalists, we've got 60 people connected. I see that they prefer staying in their room than coming here, which is so hot. And we do need to speak really about these terrible heat waves. So we have with us Claire Nulis from WMO, who has brought us John Nair, who is the Senior Extreme Heat Advisor of WMO. I'm happy to hear that WMO has an extreme heat advisor, sir. And we have Panu Saaristo, who's on Zoom from Budapest, who is the Emergency Health Unit team leader of the International Federation of the Red Cross. Tommaso Della Lunga is here with us, also together with Mrinalini Santanam. Mrinalini, I'm not sure people know you yet. We have, I don't think you have briefed yet. We will distribute our journalists your contact details. So we are here to speak about not only heat waves, but also the impact on health. And I'll start maybe with Claire, and then we will go to John and then to Panu. Claire.
Yes, good morning, everybody. Many parts of the world, the Northern Hemisphere specifically, are gripped by intense, extreme heat waves, many cases long-lasting. The World Meteorological Organization and our members who are the National Meteorological and Hydrological Services obviously are monitoring the situation very, very closely, issuing many warnings, many alerts. If a new temperature record is broken, we will advise you of the fact. We are posting regular updates on the website, on social media, so please follow us in the coming days. So I've had briefers in this room in the last couple of weeks to talk about the climate aspects of what's happening. Today we're putting a focus on the impacts, and specifically the impacts on health. So I have John Nairn, who's Senior Extreme Heat Advisor. Also in the room is Joyce Schumacher-Guillemot of the joint World Meteorological Organization, World Health Organization Climate and Health Office. And obviously we're around during summer to, most of summer, to answer any questions that you do have. Over to John.
Thank you, Claire. John here.
Good morning, and thanks for the opportunity. Heat waves are amongst the deadliest natural hazards with hundreds of thousands of preventable deaths each year. It's a rather poorly understood hazard. Heat is a rapidly growing health risk due to increased rapid urbanisation, the increasing extreme temperatures, and an ageing population. The impacts on people, economies, the natural and built environment are very serious. A recent study has calculated that in Europe last summer, 60,000 additional people died due to extreme heat. And that number is considered to be quite conservative by the experts who did the work, as well as government. And it's worth noting that that number is for Europe. And of course, we're seeing extreme heat waves widespread around the world. And Europe has some of the strongest early warning systems and heat health action plans in the world. So you can imagine what the numbers are likely to be globally. So we are seeing continuing growth in the frequency, duration, and intensity of heat waves. And this is entirely consistent with the science of global warming and IPCC reports. These events will continue to grow in intensity, and the world needs to prepare for more intense heat waves. The recently declared El Nino is only expected to amplify the occurrence and intensity of extreme heat events. So we're in for a bit of a ride, I'm afraid, and they will have quite serious impacts on human health and livelihoods. One of the noticeable phenomena that we've seen is that the growth in simultaneous heat waves around the Northern Hemisphere has increased sixfold since the 1980s. This trend shows no sign of decreasing. It's also worth noting for the current event that July and August are the most critical months for extreme heat waves. We've already seen them impact Asia, North and Central America, Africa, the Middle East, and now Europe. So I'm not telling fibs. It is increasing. But more importantly, we need the world to broaden its attention beyond the maximum temperature alone. In many locations where the maximum is reaching into the high 40s or higher, the temperature may still be near 40 at midnight. So in these circumstances, the minimum temperature is more important for health and failing critical infrastructure which supports these people during extreme heat waves. So repeated high nighttime temperatures are particularly dangerous for human health because the body is unable to recover from sustained heat. This leads to increased cases of heart attacks and death. And it's not the only diseases that we see, but they're the notable ones. While most of the attention focuses on daytime maximum temperatures, it is the overnight temperature which will have the biggest health risk, especially for vulnerable populations. So the WMO is continuing to develop its policies, particularly to integrate early warning systems and early action response systems into heat action plans that will protect vulnerable people where they're applied, and also to help sustain critical infrastructure. WMO is updating guidance on heat health warning systems and works with the World Health Organization and a wide number of partners and governments through the Global Heat Health Information Network. And WMO is also standardizing terminology and definitions for extreme heat. We feel that the categorization of heat wave intensity will standardize our impact forecasts and warnings worldwide, and that will have an impact in terms of people's understanding of the phenomena and how to respond to it. And finally, I'd like to add that it will be everyone's individual responsibility to have extreme heat plans because in the end, government can only do so much, and these events are rather dangerous and you need to have something to fall back on. Thank you.
Thank you very much, John. Panu, you are you're leading the emergency health operations of IFRC from Budapest. You have the floor.
Thank you for allowing me to put a spotlight on what the Red Cross societies in Europe are doing to help people to cope with the effects of heat waves. Heat waves are really an invisible killer. We are experiencing hotter and hotter temperatures for longer stretches of time every single summer here in Europe. And as we heard, it's not a European phenomenon, it's everywhere around the globe. In the past 10 years, more than 400,000 people have died from extreme climate and weather-related disasters, according to the World Disasters Report that my organization, the IFRC, is publishing. And every one of these deaths is a tragedy to the families and loved ones that they leave behind. As we heard from colleagues, infants, the elderly, people with chronic health conditions are at a particular risk. Most heat-related deaths in these heat waves do not occur because of heat stroke alone, but because of the impact the heat has on people with pre-existing conditions, cardiovascular, respiratory diseases, and so forth. But deaths from heat waves can be greatly reduced with relatively simple solutions. And that is why Red Cross societies around Europe are implementing these simple, low-cost actions all over Europe to help the population struggling with extreme temperatures. Let me give a few examples. The Italian Red Cross, they are checking up on elderly people via telephones to ensure that the elderly people are safe from extreme heat. Similarly, Portuguese Red Cross and French Red Cross are sharing practical tips through social media so that you don't leave your children or animals in parked cars, the importance of using sunscreen, wide-brimmed hats when you are exposed to the sun, and so forth. The Hellenic Red Cross, the Greek Red Cross Society, has been handing out drinking water and reminding the locals and tourists to stay hydrated, because once you feel thirsty, you are already dehydrated. Romanian Red Cross is doing the same. Further, Spanish Red Cross, that has experienced enormous heat waves for several years, they maintain shelters for people impacted now, especially by the La Palma wildfire, and they're also providing shelters for pets together with the local government. Spanish Red Cross is also reminding people through social media networks to protect themselves from breathing in the wildfire smoke, which can aggravate pre-existing health conditions and be very, very dangerous. And these high temperatures lead to very dry vegetation, and the combination can create extreme fire danger, which is part of our messaging and information to the population. One more example, the Turkish Red Crescent. They are also responding to forest fires in 6 provinces in their country, and volunteers and staffers of Türkizilay have been providing food and emergency aid since Sunday night because of the fires. During these times, it's crucial to pay attention to the people that face the biggest risk. They are not only people that are vulnerable because of the health conditions, socioeconomical conditions and living arrangement can also induce risks. So low-income people in the continent cities really bear the brunt of this invisible emergency. And these heat waves also impact other areas of society through reduced economic output, strained health systems, and even power outages. Unsurprisingly, urban areas are among those that are hit the hardest because cities are hotter than the surrounding countryside. The International Federation of the Red Cross and Red Crescent Societies, the IFRC, has created a heat wave guide for cities. This guide helps governmental and community leaders to future-proof their communities. And it can be accessed on our website, ifrc.org. More than half of the world's population lives in urban areas, but according to the United Nations, this is expected to increase to 2/3 by 2050. Now is the time for cities to incorporate heat reduction measures in their strategies and plan for more green spaces in their cities. IFRC is currently engaged in work to better protect some 250 million people from heat, those people that are most ignored by rapidly rising climate risk by 2025. In at least 150 cities and towns, according to our plan. There's a strong evidence that the frequency and intensity of heat waves are expected to rise around the globe because of the climate change. Current extreme surface temperatures along the Mediterranean are fueling the heat wave by keeping nighttime temperatures at uncomfortable levels, worsening the impact of human health, as per our climate center, the Red Cross Climate Center in the Netherlands. Preparedness and early warning systems become more and more paramount. The International Federation of Red Cross and Red Crescent Societies is committed with our national societies around the region and around the globe to combat the deadly effects of heat waves in Europe and around the world. Together, and only together, we can beat the heat. Many thanks.
Thanks to you, sir. And I'll open now the floor to questions. First in the room, Nina Larsson, AFP.
Hi, thanks for taking my question. I was wondering, first off, when it comes to heat records, so you announced yesterday there was a new heat record from 2021. How likely do you think it is that that might be broken in coming days? And also, I mean, is what we're seeing now, you're talking about preparing for more intense heat waves. So is this a new normal, or is this not even touching the new normal? If you could say a little bit more about that, thanks.
John?
So maybe the new normal first. Every year we'll have interannual variability. It'll be governed by the way in which the oceans respond to the changes, and we see, of course, that the El Nino is kicking in right now. So as we move through different cycles of the global temperatures, we will see additional pressures or a backing off. But it is worth noting that even during the La Nina years, the global temperatures are now warmer than they were back then the El Niños back in the 1980s. So the global trend is continuing to grow. So I don't know that we can actually talk about normals, because it will keep changing. It will just keep getting warmer. Sorry, the first question?
Changing for the worse.
Well, I'm afraid it gets warmer. Oh, records. I'm not sure what to say about the records. I'm going to pass that to you.
Yeah. Yesterday, the World Meteorological said that we have recognized a new temperature record for the European continent, and that was recorded in Sicily in August 2021, and it was a temperature of 48.8 degrees Celsius. We don't know yet if that record will be broken. But if there is a new reported new high, we will set up a rapid assessment team to assess this. But then the actual full and final verification, it does take time. It's quite a lengthy process. It's because we need to get it right. But I can't predict what's going to happen. And we're still mid-July. We still have August to go.
Thank you. And Panu, if you want to add something, just put your hand up so that I know I should give you the floor. Jan, I think this hand is, as you said before, for the other questions, so I'll go to Jamie. Jamie Keaton is our correspondent of Associated Press. Jamie.
Hi, good morning. Thank you very much. I wanted to just follow up on the question of the methodology, if I could, just really quickly. Claire, so what you're saying is that if there is a suspected heat record, that you'll call it a preliminary finding? I mean, could you just tell us, because it took you 2 years to confirm the previous one. So just, I just want to make sure that we get the proper phraseology of that. And then the second thing just has to do with, you mentioned that in the coming days, you're expecting some intensification of records of the temperatures in Europe, it seems. Could you just tell us, that's obviously maybe not with the El Nino factor, what makes you think that we're going to see an intensification in the next few days?
So on the procedures, if you look on our website, we posted quite a detailed story yesterday. And this is a quote from the World Meteorological Organization Weather and Climate Extremes Rapporteur. He's Professor Randall Cerveny. He's based at the University of Arizona. And he said, climate change and temperature increase has spurred a surge in reports of record weather and climate extremes, especially for heat. We have to make sure that these records are verified for the sake of scientific understanding and accuracy. Because we are seeing an increase in reports, we've now got a 2-level procedure. So we have a sort of fast track rapid assessment, which will initially say, yes, this new reported temperature record is feasible. There are no evident faults with the recording equipment. It was recorded in the right place. We will then, and so we can do that fairly quickly. We will then go on to, and this is Professor Cerveny and his team of volunteers, and I stress they are volunteers. They have day jobs, which is another reason these things take time. They will then conduct a detailed evaluation. So, for instance, in the case of the record in Sicily, they actually had to, examine all the equipment involved. We've got 2 ongoing investigations into temperatures which were recorded in Death Valley in the United States in both 2020 and 2021. Now, the sensors which recorded both of those temperatures, they had to be sent away to be examined just to make sure that everything is working right. So, yes, it is a very slow, very painstaking process, but we want to get it right. We're not doing this for fun. We need to get it right. It's not just a case of, hey, we've got another record for the Guinness Book of Records. It's, it really builds up an understanding of our climate and the extremes we are seeing.
Thank you. Again, Pano, if you want to add something, just raise your hand. I have Jeremy Lange, Radio France Internationale.
Yes, thank you, Alessandra. I would like to have maybe a comment on what you said earlier. You mentioned places in Europe where the temperature is around 40 degrees at midnight, if I understand correctly. I would like to know what are those places exactly? Are we talking about Italy, for instance? And then you mentioned that the risk that people have when you have those kind of temperatures at night, does it mean that you actually have more risk to die because of heat waves at night, because of exactly what you said? Do you have more death occurring at night because of heat waves? And then the second question is about what's coming next. You mentioned, of course, El Nino, but does it mean that still, since we don't have the effects of El Nino in Europe right now, does it mean that, can we take it for granted that next year in Europe will already be worse than what we have right now?
John?
So I might work my way backwards from the El Nino, of course, it has different effects according to where you are on the globe. So Europe tends to be more affected through the Mediterranean, I believe. I'm trying to pull it from my memory at the moment, but probably the bigger effect would be earlier heat. So spring, we're seeing heat waves extend into spring. So it's quite likely that you would see an earlier start to heat. I would take a point about extreme temperatures versus extreme heat. The reason why I mentioned minimum temperatures is because we're trying to understand how sustained the high temperatures are through the day and into the night. So if the minimum is high, the temperatures will kick in sooner in the day and reach a high temperature sooner and be sustained longer into the day and further into the night. So the idea that you could have very high 30s temperatures around midnight is not unusual when you have an extreme heat wave where the minimum is high. So the focus on what the maximum will reach is an extreme temperature question, is not an extreme heat question. The extreme heat is a function of how long those temperatures are staying higher. And so that's why I urge people to have a look at how high those minimums are staying, because that's an indicator of how high the temperature will be near midnight. I don't have precise locations for you at this stage. I just know from my investigations into past heat waves, when you have high minimums, you will have very high temperatures near midnight. It's just a given, and we were only discussing an American heat wave where the temperatures were 105 at midnight. I'm trying to remember the city, but I can't quite remember it. And then they had a storm and the power was knocked out. So you've got a location where they've had very high temperatures till midnight. They're relying upon air conditioning. The air conditioning fails, and what do? You know, you've got a very hot night ahead of you. So, and it's not just that we're talking about countries that have these resources to call upon to cool themselves. We've got many countries where this cooling infrastructure doesn't exist, and these people are exposed all the time. So we could probably supply locations in the past where those temperatures have occurred, but the Mediterranean heat wave, it is big, but it's nothing like what's been through North Africa. And it's developing into Europe at this stage. We're in the early phases of this heat wave with forecasts that are not very pretty.
Claire.
Yeah, if I could, and I can send out more details. One specific example is Phoenix, Arizona, which is a major city in the US, which has seen an extraordinary spell of temperatures above 110 degrees Fahrenheit in the daytime. But what's worrying people, it's just that, you know, these nighttime temperatures are just not going down. And as John said, that's when the body needs to recover. But I can send you some more specific examples.
That would be appreciated. Emma Farge, Reuters.
Good morning. I'm wondering if Europe is better prepared than last year when 60,000 extra people died. And could you say a few words about how much pressure the European healthcare system is under currently and what sort of health emergencies we're seeing and where? Thank you.
Maybe this is more a question for Panu. I don't know if you want to take this one.
Well, I can speak for the Red Cross and Red Crescent network. We have clearly tried to learn from last year and from the high death rates and tried to prepare our national societies with knowledge bridging, sharing best practices, and also providing funding from our disaster relief emergency fund, which we can quickly allocate to national societies in an anticipatory manner for the national societies to take immediate action. It's also a question of focusing. The focus needs to be on the most vulnerable and those settings that are after in climate adaptation, so that we can reach and inform and include those people that are most at risk. And we are definitely focusing on reducing risk of these climate-related disasters. And we encourage the authorities who are more responsible for the healthcare sector, the hospitals that take the brunt of the increased healthcare needs to also to do the same. The anticipatory and early action is really important because it reduces the impact of this type of slow onset climate disaster. Thank you.
John?
I might just add that health alone can't solve the problems with heat. We've had workshops with the G7 and also a roundtable in Washington with all the health experts who have been tackling this problem for some time, and they're getting good at what they do, but they're calling out that they can't do it on their own and that governance is a key issue, and the actual process of reaching out beyond health as the responsible agency to deal with heat is one where we can build resilience across our infrastructure. We can't have power failing and have health systems with people at home on medical equipment, relying upon that equipment. Who's responsible? Is it health? It's governments that need to think through these issues and build stronger governance issues that pull in all of society to help solve the problem. Thank you.
Thank you very much. Jamie, you have a follow-up?
Yes, I do. Just want to really quickly, I mentioned a question earlier about, how do you know that this intensification is going to happen, and how do you know, Mr. Nairn, you said earlier that this is just the early phases of the heat wave in Europe that we're seeing right now, if I understood you correctly. How do you know that, and how much is this tied to climate change? I don't think we made that specific connection there, at least not. I mean, you mentioned IPCC, but just if you could say, and finally, how does this compare, just for the average person on the street, how does this compare to what we've seen in previous years? Are you very concerned that we're seeing a greater worsening and intensification of these heat waves generally? Thanks.
John?
Sure. Look, the story that since the 80s we've got a 6-fold increase in simultaneous heat waves is there in the data, and the trend line isn't changing. We're seeing the global oceans exhibiting greater thermal anomalies, which is helping to drive these higher temperatures. You're seeing the loss of global ice. We talk about the 3 poles, the North Pole, the South Pole, and the Himalayas, or the permanent ice on the continents. Those are critical for the weather systems that we rely upon to give us stable weather patterns. Now in the Northern Hemisphere in summer, they are too stable. The jet stream is wandering around, like, there's expressions I won't use, but anyway, it's very wobbly, and it ends up with parked weather systems that accumulate a lot of sunshine and heat in one location that moves extremely slowly. These are not your normal weather systems of the past. They have arrived as a consequence of climate change. The North Pole ice, and that is reinforcing that mechanism. It will continue, and it will continue for some time. You have to reverse it. You have to do climate repair to change it. So it is global warming and is going to continue for some time.
Thank you very much, John. That was absolutely clear. Lisa Schlein, Voice of America, in the chat is asking IFRC to send the notes, and Tommaso is here and is nodding, it will come. By the way, James, if you're still on the line, it seems UNICEF has not yet sent the notes on immunization, and they would appreciate receiving them. So thank you very much.
You should have received our notes.
Yours,
so
okay.
say, yeah.
Sorry, there's still, I see a hand from Agnes Pedrero, also AFP.
Yes, hi, hello, good morning, everybody. Thank you for taking my question. So WMO and in general, every organizations are alerting those days about those heat waves and records. We only heard about that every day and about how we have to adapt. The question that that sometimes I think people would like to understand is what they can do at their personal level, not to adapt to this climate change, because that we have heard, but how to reverse that climate change, what they can do, and not expecting that countries will take their engagement. And I think this part of the story is really not heard, or at least for my part, for my side. So what you can do and say to those people, what they can do to reverse this climate change. And because I think people is hearing every day that there are records, they know that, and they live that. So what you can say? Thank you.
Agnes, I think, it's there are a number of things that I think not only the agencies, but everybody, at least in the United Nations, first and foremost, the Secretary General are saying and has been saying for a very long time on what we can do to reverse, as John said, restates climate. I just invite you to have a look at the statement that we have distributed to you the other day when he was in Brussels, speaking about the issue of SDGs and climate change and how people can really act on on this, even at the personal level, but of course he has been insisting a lot on the issue of fossil fuels and the need to stop and revert this issue, this exploitation, and including, of course, all the implications at the financial level. I don't know if, John, you have a specific advice to give, maybe, or Panu, but really there is a lot we have been saying, and we can give you again all the numbers and all the actions that people need to look at and implement if we want to do something at the personal level, and of course at the national and regional
I think
level.
the simplest thing is electrify everything. It's a simple message. It means stop carbon fuels, just electrify everything. It'll make a lot of difference. Thank you.
Yeah, exactly. Stop fossil fuel. I think it's one of the key words. Okay, so thank you very much. Thanks, Tommaso, for answering the request of notes. I would thank also, of course, Panu Saristo for being with us on Zoom from Budapest, John, Claire, and their colleague to be here to tell us about this incredibly important phenomenon. And now let's go to our last speaker, who is also from the IFRC, Xavier Castellanos, who is the Undersecretary General of IFRC for Operations. Xavier, you are coming to us from Nairobi for a briefing on Sudan. You have the floor.
Thank you very much, and good afternoon to everyone. Let me start by saying that this conflict has deep humanitarian consequences in Sudan. And as we saw in Ukraine, also is having consequences in neighboring countries. People from Sudan have fled to Chad, to Ethiopia, to Khartoum, to South Sudan, to Egypt. But this conflict lacks concerningly of financial resources, and this deepens the humanitarian consequences. The IFRC appeal, just to give an example, has received 7% of 60 million Swiss francs to support to the affected population. In a country where more than 40,000 volunteers remain in capacity to provide humanitarian services, where 2,000 of them are actively every single day in the affected areas, responding and doing its level best to support humanitarian communities in providing humanitarian services. This is an example of how concerning the financial resources to support people in need we are facing right now. We know that more than 3 million people have now been displaced, but also the millions that are in the middle of the conflict who have had no other option than staying in their homes. It's about a conflict happening in a country that was already affected by the flood, by the food insecurity, and by socioeconomic impacts due to compounding crisis affecting Sudan. As we all know, the rainy season is about to start, bringing the risk of floods and increasing diseases and added difficulties in getting access to people in need. The previous session was about heat waves in Europe. I just returned from Sudan, where the temperature was around 41 degrees, where communities are in conditions that obviously are not the ones that we are expecting if we want to deliver services and to maintain the lives and living conditions of the people in a good shape. So coming from the field also, I visited Ethiopia and Sudan, where I spent 2 weeks. In Metema, at border location with Sudan, the unmet needs are obvious. People from Sudan may take days or weeks until they are able to enter to Ethiopia. Until that process takes place, they have no other option but to stay between the two borders in improvised huts. Others may stay under a tree, sheltering from the weather, or even sleeping on the road, avoiding snake bites. There is a worrying number of arrivals that have reported being victims of sexual and gender-based violence on their route from Sudan towards Ethiopia. Women and children show evident needs of protection and limited health services in the area as well are evident. One of the persons I spoke with said to me, "We demand to be treated with respect and dignity. I am a woman with a child that the only available tent in the area requires that I sleep in the same place that men are staying. And she said, I am a Muslim and a woman do not sleep in the same place as where men are." In Sudan, the Sudanese Red Crescent Society has been on the ground since the fighting erupted on 15th of April 2023. Through its branches and units, the Sudanese Red Crescent Society has a presence in 18 states of Sudan, and volunteers have continued to respond throughout the conflict with its neutral status, meaning it's able to gain access across both sides. Over 400,000 volunteers has this national society that are being trained with the skills, with the knowledge. And from those 400,000, at least 10% of them have been activated across the country and in the conflict affected areas. 2,000 every single day. 2,000 of them every single day are responding across the states, providing humanitarian services, including in Khartoum and Darfur. Staff and volunteers count also as IDPs and are also victims of the conflict. Some of them reported that their houses have been looted, taken, or affected by the crossfire. Nevertheless, they are actively involved in dead body management and dignified burials, providing first aid, distributing NFIs whenever are available. More than 100 of them are supporting in clinics in Khartoum, in hospitals, in health centers. Many others are providing psychological first aid, distributing food with an agreement that the National Society has made with World Food Program. The Sudanese Red Crescent Society has access to the food, and the volunteers and the staff are the ones to negotiate with the parties of the conflict to access to distribute supplies to the stranded communities. In the same way, as I described before, they negotiate to provide dignified burials. Such a difficult role to play in the middle of a conflict. All of them has expressed that they can do more if resources were available. But the sad reality for this conflict is resources are scarce. At least the IFRC and our support to the National Society is something that really represents an issue of concern. The world is turning away. The needs are enormous and mounting daily. The biggest strategy is how poorly funded our emergency appeals are. As I mentioned, I was in Sudan. I went to Port Sudan and visited several reception centers where I heard the same thing from the affected communities the Sudanese Red Crescent Society told me before. We need food, we need medicine, we even more for cases of chronic diseases. We need cash to be able to cover our needs. All people were clearly under huge stress and will need mental health support by every means. The situation is very clear what they are going to need in terms of mental health. A host family typically receives up to 3 displaced families and demonstrate great solidarity with the Sudanese population. The stress on host families is high. In reception centers are packed. Those reception centers that have a room available can host in each room up to 15 people. Some centers are better off than others, but all of them are showing clearly the unmet needs. In one of the centers, the administrator showed me the food that was available for the rest of the week. It was just 2 boxes with vegetables and a bag of flour. And he said, this is the only thing I have left for more than 120 people that were hosted there. I do not, and he said, I do not know what I will do tomorrow. I have to say, we couldn't answer him how we can help him without having the resources with us. This is a crisis impacting already vulnerable people. Let's remind that 11.7 million people in Sudan had existing acute humanitarian needs prior to the conflict. The majority of those forced to flee are women and children, and a significant number of people are fleeing violence for a second time, having been displaced in the camps in Sudan. Red Cross, Red Crescent societies are prioritizing the needs of women, children, old people, and people with disabilities who are disproportionately impacted. The IFRC Regional Emergency Appeal supports national societies working with those who have fled to the 6 neighboring countries, with one of the major focuses that are protection, gender, and inclusion. Within Sudan, the revised emergency appeal also has a focus on protection and its humanitarian service provision, in particular women, children, older people, and people with specific needs. Finally, to say that all the humanitarian ecosystem is doing its level best, but my plea is that we will need to put in the minds and hearts of the international community that this conflict requires the financial resources that are needed in order to really address the humanitarian needs of the people and especially dignify the lives of the people affected by this conflict. Thank you very much.
Thank you very much, Mr. Castellanos, for this extensive briefing. Is there any question on Sudan in the room? I don't see any hand up, or on the platform. I don't see any hand up, so thank you very much for having spoken to us about this dire situation. And I also remind the journalists that over the weekend we have issued a statement by Martin Griffiths, and the Secretary General for Humanitarian Affairs and Emergency Relief Coordinator, also on the 3-month mark of the conflict in Sudan and the incredibly difficult situation for Sudanese civilians, as also described by Mr. Castellanos now. So I would like now to give the floor to the 2 journalists who had asked for other questions. And I'll start with Gorky. Gorky, vous voulez me poser votre question sur l'initiative? Est-ce que vous êtes encore avec nous? Oui.
Ah bon. Merci beaucoup. La question,
merci à vous.
Ouais, la question, elle est très simple et j'aimerais bien qu'elle, excusez-moi, qu'elle soit remontée à New York. En tant qu'Africain, en tant qu'intellectuel africain qui suis depuis une vingtaine d'années les Nations Unies, cette histoire avec cet accord nous donne un sentiment d'être floué. J'ai l'impression que depuis le Moyen-Âge, c'est le même discours de mensonge qu'on répercute inlassablement, des préjugés. Et quand des États dits forts se font la guerre, notamment quand cette fois-ci c'est des États européens en plein 21e siècle, qu'on trouve le moyen de dire que cet accord était pour aider les pays africains, alors que la liste que nous avons est là. Mais je me dis, l'aide dont on parle, c'est pour qui? C'est l'Occident qui aide l'Occident? C'est l'Occident qui arme des gens qui s'entretuent entre eux? Et ensuite, pour se donner une bonne conscience, on dit quoi? On va faire un accord soi-disant pour aider les pays africains. Et au bout du chemin, non. il n'y a rien qui est allé à l'Afrique. Je pense que la question, c'est que est-ce que les Nations Unies n'ont pas un devoir de vérité et de rendre justice à l'Afrique? Et j'aimerais bien que cette question remonte jusqu'à New York. Je vous remercie.
Alors, merci Gorky. Moi, je ne peux pas m'exprimer mieux que le secrétaire général l'a fait quand il a dit hier dans les remarques qu'il a prononcées à New York qu'il était profondément déçu. Il a dit vraiment ces mots-là, I'm deeply disappointed par cette décision. Et il la regrette profondément aussi. Je pense que le secrétaire général a donné des chiffres très clairs. Les PAM avaient, grâce à ces projets, à cette initiative, envoyé plus de 725 000 tonnes en support d'opérations humanitaires, en particulier pour le Corne d'Afrique et le Yémen, mais aussi en Afghanistan et dans d'autres pays qui en avaient vraiment besoin. Cette initiative avait permis vraiment de garder les prix de la nourriture basses, en tout cas plus basses, et on a vu déjà hier que ces prix commencent à monter. Et je pense que vraiment, je ne peux pas le dire mieux qu'avec les mots du secrétaire général, auquel je vous invite à vous référer, où elle dit qu'il y a tout simplement trop, qu'il y a un jeu pour les mondes affamés et dans les besoins. Et il n'est pas possible de laisser les choses comme ça. Donc lui, il fera tout ce qu'il peut. Et déjà, bien sûr, ces actions ont commencé pour trouver une solution d'une autre façon, si on ne peut pas le faire à travers ces deux accords, pour que la nourriture et les fertilisants, que ce soit de l'Ukraine ou de la Russie, puissent de nouveau être exportés et arriver justement, comme vous disiez, à ceux qui en ont les plus grands besoins, nonobstant le conflit qui continue à opposer ces deux pays et la guerre de la Russie en Ukraine. Donc vraiment, je vous invite à regarder les mots. Je pense que le secrétaire général a vraiment parlé avec son cœur hier et il a dit, et vous avez tout à fait raison, c'est après les pays les plus vulnérables qui souffrent de ces situations. Donc on continue à être mobilisés pour que cette situation n'aille pas ses effets néfastes sur les populations les plus vulnérables. Je vois que Emma has their hand up, but I had promised the floor to Jan. So if Jan is still with us.
Yes, I am.
Yes, go ahead, Jan.
Yes, good morning. Many thanks for giving me the floor. Yeah, it's on the grain initiative. 2 points. Yesterday, we got the media advisory on the SG's statement only 10 minutes ahead of his statement. That was really quite short. And I would like to ask you to give us more time in advance to prepare. It was, I think, 4:30 in the afternoon. It was quite late for the print editions. So I couldn't use the SG's quote in my version for my print edition, Tagesspiegel and other papers. I couldn't use it anymore. That was not very comfortable. And secondly, I was wondering, why don't we have a briefing with the Secretary General of UNCTAD on the grain initiative? She's key in negotiating with Russia on the memorandum of understanding. But as far as I remember, she hasn't briefed us for months on this issue. And this is really worldwide news. And we don't hear anything from UNCTAD. That's really quite astonishing. So I would like to ask you to organize a briefing with Madame Greenspan on this issue. Many thanks.
Jan, thank you very much. So let me explain how it went yesterday. We were awake, but New York wasn't. When the news came of the letter that had been given to the JCC with the announcement of the termination of the Russian participation in the Memorandum of Understanding, this came at the moment when New York was sleeping. We, of course, immediately started having questions from the journalists. We couldn't do much more than wait for New York to wake up. I answered, thanks to our colleagues in New York who were up very, very early. We gave some information to the journalists that consulted us to say that we were expecting an announcement or a statement from the Secretary General, which indeed came. And you have to think that it came at 10:30 New York time. The Secretary General had a speaking engagement at the high-level political forum just before that he could not change. So he did the statement as soon as he had finished the other engagement. And we have distributed to you under embargo his remarks as soon as they came from New York. So it was really one of those cases where indeed things happened here on another time zone, and we had to wait for New York to wake up, but we tried to support the journalists who had asked as much as we could. And again, the information on the statements came at a certain time when they woke up, and we gave it to you immediately. So I understand that it was not very convenient for this time zone, but it happened as soon as humanly possible. Really, we immediately informed you when we had this information ourselves, and the Secretary General gave the statement as soon as he could. So this is on your first point. On the point of a briefing by Mrs. Greenspan, I can only turn to Catherine, who is online, and give her the floor. But I'd just like to remind you that Mrs. Greenspan has participated to the press conference that the Secretary General gave together with the Executive Director of ESCAP a few days ago on the latest briefing of the high-level group that she chairs, and she answered questions also on the situation of the Black Sea Grain Initiative. But I let Catherine answer on this.
Yes, good morning, everyone. Thank you, Alessandra, for reminding that she spoke to you a few days ago. I have forwarded the request for her to comment, and she will do so when she thinks it's relevant. So we are working on that, and we will let you know in due course when she will be commenting. Thank you.
Thank you, Emma.
Yes, also on the Black Sea, please. We're using the word terminated in copy. I'm wondering, is it really over from the UN's point of view, or are there any efforts at all behind the scenes to revive it? And I guess that's for you, Alessandra, or for Catherine. Is it over from your point of view?
Well, again, I think the Secretary General has been very clear. The letter that came to the GCC used the word terminate. So I think it is pretty clear what it means. Terminated is terminated. And of course, as the Secretary General said, we are very mobilized to continue looking for solutions. The two agreements as such have terminated. Doesn't mean that we will not find some other way, either practical or through agreements to solve the dire situation that this termination has created. But the word used, I can confirm, was terminated. Gorky.
Merci beaucoup, Alessandra, pour votre tentative de réponse de tout à l'heure. Il y a une partie que je peux assumer, mais il y a une autre partie qui ne répond pas, moi, à ma préoccupation. Loin de moi, la tentative de faire de la quémande pour l'Afrique. L'Afrique n'a pas besoin de quémander. L'Afrique a assez de moyens pour pouvoir vivre et survivre. Ce qui est vrai aujourd'hui, vrai pour la France, vrai pour les États-Unis, vrai pour l'Italie et tous les pays du monde, c'est que nous vivons dans un monde d'interdépendance. Ce que je voulais dire dans mon interpellation, c'est que nous n'avons pas le droit, en tant qu'organisation internationale, c'est-à-dire vous, Nations Unies, de laisser dire des choses sur un continent alors que les réalités des faits sont totalement différentes des choses pour lesquelles on fait des speeches. C'est que l'Afrique n'a pas besoin de misérabilisme. Elle a besoin d'être respectée. Elle a besoin de justice dans le narratif. C'est ça que je voulais dire. tout en acceptant une partie de votre discours en disant qu'on avait fait un appel, soi-disant pour aider des pays. J'ai entendu durant ce briefing les pays pauvres, les gens qui... Mais ça n'existe pas. Il faut que dans le narratif onusien, que dans le discours que nous utilisons ici aux Nations Unies, que nous puissions réadapter notre vocabulaire. C'est ça que je voulais dire. Parce que quand on fait de l'histoire, depuis le Moyen-Âge, ce sont les mêmes discours qui reviennent rabâchés, remis un peu au goût du jour, mais qui n'ont plus aucun sens pour nous, Africains, en tous les cas. Je vous remercie.
Je pense que c'est bien noté, Gorky, vous avez tout à fait raison. Il n'est pas question de faire du misérabilisme ou quoi que ce soit. On parlait des pays vulnérables et ce n'est pas nécessairement tous les pays africains, loin de là, au contraire. Et j'en veux pour preuve que demain, et ça me donne l'occasion d'annoncer ça, demain au forum politique de haut niveau sur le développement durable, par exemple, il y aura une journée Afrique. On vous a envoyé l'invitation parce que c'est un événement virtuel. Alors, ça se passe à New York, donc effectivement, les sessions de l'après-midi seront un peu tard pour nous, mais c'est ouvert à toute la presse et à tous les partenaires. Et c'est vraiment, par exemple, un événement dans lequel on pourra voir ce que l'Afrique fait et de façon très concrète, parce que les discussions vont se focaliser sur les pays qui présentent leur, ce qu'on appelle en anglais les Voluntary National Reviews. Je me lance pas à faire une traduction, je ne sais pas exactement, mais c'est les pays qui ont développé des plans justement pour le développement durable. Et on aura donc des discussions sur le Burkina Faso, la République centrafricaine, les Comores, la République démocratique du Congo, la Tanzanie, le Rwanda et la Zambie. Donc ces pays vont parler de ce qu'ils font concrètement pour le développement durable. Et ça sera très important en vue aussi du sommet des objectifs de développement durable du mois de septembre. Donc absolument bien noter ce que vous dites, mais c'est vrai que dans le cas de la fin de l'initiative du Grand de la mer Noire, c'est important, je pense, et comme l'a fait le secrétaire général, de parler des situations humanitaires pour des pays particulièrement vulnérables. Et je vois encore qu'il y a there's still a hand up by John.
Yes, can you hear me there?
We can.
Yes, hi. Yes, my question is concerning following up to Jan's comments on the Black Sea Grain Initiative. I'm interested in the remarks by the Secretary General. He was citing two Russian exporter groups for the grain data and the fertilizer data exported from Russia. Is it possible to get some data sets from UN agencies closely involved in these negotiations, either from UNCTAD or FAO or the Secretary General's office? Surely there must be clear data that the UN has other than grain associations, exporters, which are not as reliable as the data where is collected at the receiving end of the importing country. This is basics, and I was stunned to see no official data in the Secretary General's report.
John, I would invite you, I let, of course, Catherine answer on UNCTAD side. There is a lot of information, sorry, pardon, on the website of the coordinator, the UN coordinator for the Black Sea Grain Initiative. We have sent you, I think it was yesterday, the day 25, a note from that office from our good friend and colleague Ismini Palla, that I'm sure you remember, where there were some numbers, but also the links at the bottom of a number of resources. I have not gone too deeply into it, but I would like to invite you to have a look first at this, because there were really a lot of information, and Ismini is available also to answer questions. I know UNCTAD has also another array of data, and maybe I'll pass the floor to Catherine on this.
Yes, it's difficult to have all the data on fertilizers, but I will ask again. You know very well, John, that we've tried to provide you with this type of data, and let me check again, and I'll get back to you.
John?
Over.
Thank you. I'm aware of the excellent work done by the UN office in Istanbul. But my question was with reference to what the SG said concerning the Russian MOU data set. The stuff that JCC concerns the MOU between Turkey, Ukraine, Russia. And so, yes, I'm aware of the other data set, but I'm interested more in getting more reliable data collected by the importing countries receiving goods from Russia. Thanks very much.
I think Catherine has taken good note of this.
Yes.
And really, this was the side of the Memorandum of Understanding, which was mainly looked at by UNCTAD. So she will come back to you. Yann, les mots de la fin.
Yes, thanks for giving me the floor again. I was wondering, what is the way forward now in terms of the initiative? Is the UN launching a new attempt to revive the two agreements, and especially is there an initiative to approach Russia on this matter? Many thanks.
Look, the only thing I can tell you is that, as the Secretary General said, the United Nations as an entity will continue to do whatever we can to ensure that these fertilizers and food gets to the market, because this is really critically important for everyone, for the world, not just for, as we said before, for some vulnerable countries, but for every country. How this is going to take place, obviously, I cannot tell you today. The discussions have already started yesterday. The spokesperson of the Secretary General said during the noon briefing that it is, we have not been losing one moment and already started to try and and with the contact that has been established, with the work that has been done until now, to look at ways to ensure that this products gets on the market. So I cannot tell you how exactly now, but let me confirm that we've already started working on this matter. And this, sorry, concludes the questions. I have already spoken to you today about the Africa Day. And I'm just looking for the last announcement here that I had for you. And it was that about the Committee Against the Torture that will start reviewing, has started with the time that is now, reviewing the report submitted by New Zealand, and the next country to be examined by this committee will be Romania. That concludes the announcement I had for you. I thank you for having followed this extremely long briefing, but very, very interesting. I wish you a cool, as much as you can, day, and I'll see you on Friday. Thank you.